I don't have my doctorate. Wish I did. So you can just call me Dalton. Um, but we'll go ahead and get started on this. Sharing my screen now. So hopefully people can see that. Now, I think most of my presentation is just going to be a bit of a ramble and or rant about things that I think are important or things that I've learned from people along the way. Um, I was asked to talk about my experience doing research, my path in education, decisions along the way. And so, in telling that story and doing so, I'm hoping to at least provide some resources and stories and information that can help people also make those decisions. But I recognize we have some people who are in high school, whereas some people are just about to graduate from university. So there's diversity in that. But basically, to tell this story about my progress and my interest in healthcare and focusing specifically on the title of how political systems impact healthcare. I'm also going to tell the story of how I acknowledge the role that politics plays in creating healthy populations, because I think this is an assumption that people take for granted, right? Healthcare is something that happens at the bedside. Um, and so in telling this story, that's something I'm hoping to communicate as well, as you will soon see. And I guess my overall goal here is just I want to leave everyone here in person, but also the people who signed up for the recording, leave y'all with a framework for thinking about the issues that you care about, whether they are health related or not. Um, I'll be making the case that the current frameworks for thinking about the problems, like problems in health, are failing us. And so for me, I think that's the best career tailored advice that I could possibly offer right now. So I'm going to go ahead and get started going straight from the beginning, high school, before we dive into some of the meat. So for me in high school, science was absolutely my thing. I loved it so much. Took biology, chemistry, physics all at the same time. That was um, in part the things that were available to me at my school, like mini schools. STEM is seen as one of those things that's what the successful people do, right? You go and you become a doctor and you do these things. And so at my school, there was a public high school, but we still had a large emphasis on STEM. And that's where I found myself gravitating towards. And so during high school, I did research, microbiology research at a local university, then spent one summer doing neurobiology research, and another summer focused also on neurobiology. And so science was, in short, my thing. And I'm from this kind of small town by Daytona Beach, about an hour coastal of Orlando. So that's where I'm coming from here. Now, in terms of what came after that, which is actually pretty recent, I wish I could have the doctor title, but definitely not yet. um, and so I ended up going to Cornell University in Ithaca, New York. I chose the school because of the diversity of sciences that are offered, and the ability to explore the sciences based on my experience in high school. And so came in as a bio major. I was pre-med, wanting to attend medical school. Most of my classes were biology, chemistry, and calculus all my first year, and I enjoyed those classes, right? But I kept finding myself asking peers what classes I should be taking the following semester. What would you recommend? In a very similar situation as a lot of current new undergrads or high school students even. Um, and a lot of people suggested I take anatomy and physiology or human biology and things that would basically prepare me better for attending medical school, operating under the assumption that when I go to medical school, I would have to retake some of those classes and I would have already learned the content and I would be able to do better in the courses, which makes sense in some respects, right? But at the same time, it rubbed me the wrong way because I think so. I'm currently based in the UK, and in the UK, if you want to go to medical school, you go directly after high school, and it's longer. Whereas in the United States, we have a different structure where you do undergraduate and then go to medical school. And so during undergrad, you can study whatever you want. Of course, there's a pre-med curriculum, right? You take certain classes, but you can study anything. And so being presented this opportunity to take more non-science related classes and really being able to explore, but then being recommended to take these courses that I would take again in medical school, again, was something that felt wrong. And so with that decision, I ultimately decided that I am not going to major in biology. I was going to stay pre-med, but I was going to switch out of the sciences entirely. And I changed paths multiple ways. I went to policy analysis at one point, moved through sociology, but ultimately landed on anthropology. And I think there's some confusion, even for myself, about what anthropology even is. So, I mean, at the broad level, it's just the study of humans in societies, right? Study of culture, how people build lives. And I was focusing specifically on medical anthropology of how can we understand people's health? How can we understand these biological things from a non-biological perspective, from a human, from a lived experience perspective? And in doing so, it of course required I take a much broader lens for understanding health. And so instead of asking what cellular pathway caused X disease, I instead asked questions about how is the economy, politics, racism and discrimination, the movement and displacement of people, urban and rural infrastructures, and so on. How are these factors shaping one's life and one's health? And that's a markedly different perspective, of course, than from what I was studying in biology, where it was all about these are the anatomical structures that underpin this certain disease. And so when I moved to anthropology, I first off really enjoyed it. Again, these new perspectives, ways of thinking about the issues. But again, I slowly realized I'm focusing specifically on the politics part of this. And I'm going to walk you through just three case studies of how, and these are case studies that I experienced in my education that made me think, wow, health is so much more than what happens at the bedside. It's so much more than the science. And though the science is undoubtedly important, I might sound a little biased in my presentation here, but these things are so important, right? You need the science, but you also need these other aspects as well. And so that's the case I'm hoping to make today. So first, I'm going to begin with the situation that's happening in Yemen right now. So Yemen is that country right there in red in the Middle East. And my experience with this was during my junior summer. I was working with the World Health Organization in Egypt. And here is a photo of the entrance, and the office is based right here in Cairo, Egypt. And the responsibility of that office was to oversee all health activities of the Middle East and North Africa. So this entire region right here, basically. And so I was able to be exposed to a lot of different issues throughout the region. And one of the things that we repeatedly spoke about was what was happening in Yemen. So for people who aren't familiar, there is a major humanitarian crisis happening there right now. They have the world's largest cholera outbreak in recorded human history happening right now. Cholera is a waterborne bacteria that spreads. You can read more about it, but very deadly. And it's caused by poor sanitation systems or destroyed hospitals and things like that. So the WHO was pouring resources into responding to what was happening in Yemen, and rightfully so. It was it still is a very tragic situation. But in focusing on this cholera infectious disease outbreak in Yemen, I found it interesting for a couple reasons. So the reason the outbreak has gotten so bad in Yemen, why the humanitarian crisis is happening in the first place, is because of a civil war that's happening in the country. There's conflict, and one of the biggest factors driving this is a Saudi Arabia-led intervention and United States-backed intervention of bombing sanitation systems, bombing ports, bombing hospitals in the country, destroying infrastructure, all in the name of advancing a political agenda. And so while Saudi Arabia is the one carrying out these actions, the United States is providing all of the weapons, all of the intelligence to be able to make this happen, right? Um, and so something that in my work, I was on the infection prevention team, something that really irked me, or again, using this rubbed me the wrong way kind of thing, is that in our work, we always spoke about Saudi Arabia as a country that was a great example of infection prevention. They have strong hospital systems, doing great, very good quality of life, life expectancy. People don't go to the hospitals and then get infected with something while in the hospital, like in other places. But it really was weird to think that we were applauding Saudi Arabia for great infection prevention practices while they, at the same time, were causing the largest cholera outbreak in recorded human history just south of their border in Yemen, right? And so I had the opportunity to ask the head of the WHO office there, and I said, do you find it paradoxical that we applaud Saudi Arabia for great infection prevention while they wage war and cause one of the largest outbreaks in the world right now? And the head of the office, he responded, got really uncomfortable and responded, well, that's not our job. That's not how we do things here. And I really want to focus in on that for a moment, because that was something that really upset me. How is it that an organization as powerful as the World Health Organization, which is part of the United Nations, is not going to have a meaningful conversation about these upstream factors that are shaping health? And part of it is just because when we think about health, we've been trained to think that health is a matter of science. It's a matter of medicine. It's a matter of epidemiology. Politics is outside that realm. Socioeconomics is outside that realm. Environmental change and climate change is outside that realm, when it is entirely not. And so that was the first, or among the first cases when it made me realize, what are we really doing here? Why can we not have these conversations? And how should we be thinking about health? And how are we not thinking about health right now? Now I'm going to provide another case study that I was actually just talking about recently, and it relates to COVID. The North American Free Trade Agreement, sometimes known as NAFTA. Now, a lot of you have probably heard of NAFTA, might not know what it is, maybe heard it referenced in politics at some point. But basically, it's a agreement that was designed to reduce tariffs, make trade between the United States, Mexico, and Canada easier. That was basically it. We can be better trade partners, we can reduce taxes, send things over the border more easily, and then we can all depend on each other and work together, right? And it sounds like a great thing in theory. But really, this was all orchestrated by the United States for the benefit of the United States. And so let's talk about some of the actual impacts that NAFTA had. So when this was put in place in the 90s, and so we've been able to track the effects of this. But what this meant, first off, is that the United States, which can produce food very, very cheaply because we have huge factories, right? We make it for millions and millions of people. So it's much cheaper to produce things in the United States. And so when these borders opened, we could send all of our very, very cheap products into Mexico. And what happened is that all of the rural Mexican farm workers couldn't compete with the prices. And so you saw 2 to 5 million Mexicans having to abandon their farms, losing their jobs, and all of that. And so that's the first thing I want to emphasize here. But secondly, and as it again relates to health, is that since then, you have seen the Mexican diet change radically over the past couple decades. And so on the photo on the right here, I have just a Mexican family with sodas in front of them as an example. And again, I was just talking to someone about an hour ago. He's based in Tulum, Mexico right now, about how much salt and sugar and processed foods and trans fats there are in the Mexican diet. And, if we talk about obesity and diabetes and things like that, in medicine, we oftentimes say, oh, this is, this person should eat healthier or they should go on walks. And we talk about what's happening at the individual level. And rarely will they be talking about things like NAFTA, for example, that entirely changed the diet in Mexico. And so over the years, as expected, you have seen a huge surge in diabetes and obesity in Mexico because of NAFTA, because of the United States wanting to make money, putting NAFTA in place and sending all these cheap, unhealthy products for profit, right? And so now you have in Mexico one of the countries with the highest rates of diabetes and obesity in the world. And when I first started learning about diabetes, it was all about, right? It was all about insulin and all about these certain cells and the pancreas and all of the science behind it. No one was talking to me about how NAFTA created and influenced diabetes and the health of certain populations, right? And so now I want to focus on COVID because COVID is arriving on this landscape in Mexico. And Mexico has one of the world's youngest populations, which in theory should be pretty good for COVID, right? I mean, as young people, we're fortunate to not be hospitalized and have to die disproportionately because of our age. COVID's mostly affecting elderly people. And so that should be a preventative factor for Mexico as a nation. But in Mexico, we see right now with COVID that they have one of the world's highest death rates from COVID. And why is that? One of the biggest factors is the high rates of obesity and diabetes, which are among the greatest predictors of COVID hospitalizations and COVID deaths. And so we can look at places like Mexico right now and say that they are really suffering from COVID. People are dying at really high rates. And we can try to explain that. And if we do try to explain that, right, we'll say, oh, they have like a lot of diabetes, they have a lot of obesity, they don't eat healthy. But then why do they not eat healthy? There's so many different upstream factors. And as I went through my undergraduate career, just in these past 4 years, I began thinking through more of those. And really, you realize that health doesn't happen at the bedside. Of course it does. I mean, of course, in some respects it does. And what happens at the bedside is crucially important. But is it enough just to talk about that? And what I'm trying to make the case for here is no. Now, in my third and final case, I want to talk about, again, relating to COVID. So here is the 2019 Global Health Security Index. This was released by Johns Hopkins right before COVID happened. So very interestingly timed. And basically global health security refers to this industry, this department, this group of people working on preventing pandemics, basically. And so they created a map of the world and created metrics of nations that were most prepared for a pandemic and nations that were more prepared or least prepared. And so as you can see, you have the United States, Australia, Thailand, France, the United Kingdom being the most prepared for an infectious disease outbreak, a pandemic. And again, this was created before we even had COVID, so independent from COVID. And you have China, Brazil, Argentina, Belarus, different countries that are more prepared. And then you have countries that are least prepared, like Syria or Mali or Chad or Venezuela and so on. And now I want to show you another graph. So look at this real quick and find out who's the most prepared and who's the least prepared for an infectious disease outbreak and a pandemic. This was designed by epidemiologists, by physicians, by public health specialists. This is the incidence of COVID in the world right now. And so as you can see, let's look at just the United States. The United States was supposed to be the country that was most prepared for any infectious disease outbreak. And as you can see, the United States has been among the hardest hit. We have 4% of the global population, but 20% of the global COVID deaths. And so clearly there's a discrepancy here, right? Let's go back. some of the best, most prepared countries and some of the least prepared countries, right? And you see who are the most affected and who are the least affected. It's the exact opposite. Senegal, for example, in sub-Saharan Africa, has had a great infectious disease response because of previous experience with Ebola and other infectious diseases where they already have these systems in place. And there's more trust in the government and things like that. And so in showing you just this graph right here, these two graphs, I want to make the case that clearly there's something wrong in how we're approaching and thinking about public health right now. I'm not here to say this is exactly what it is, but clearly we need new ways of thinking about what is even happening and how we understand health in the first place. And again, this is why I wanted to focus specifically on the role of politics in all of this, because I mean, the United States and Brazil, for example, have been some of the hardest hit by COVID. And one of the reasons for that is because of inadequate governments that don't necessarily care or want to control COVID. And that's not really a political statement to say that, it's objective fact. And so clearly, again, there are other things happening. In Peru, for example, you see Peru was hit very, very hard. Peru followed every single protocol and recommendation provided by the World Health Organization. They were among the first nations to implement a lockdown. But why did it get hit so hard? Because it had among the highest rates of COVID, among the highest rates of hospitalization, among the highest rates of death. Why is that? Because of the severe level of inequality, because of the number of informal workers, people who aren't registered or can't be supported by the government because they're off the radar, the government doesn't count them, because just so many different factors, right? Because of public hospitals that people can actually access don't have as much investment, aren't as well prepared as the private hospitals that are expensive and that most Peruvians can't afford. And so clearly there's something else going on here. And that's what I want to all of us just to think through, whether or not we offer prescriptions. I'm not here to say you should look at this specifically. By showing this, I just want to say we're thinking about this in the wrong way and we need new perspectives. And I think that we are young people here, that we have a responsibility because we're the next generation coming into this and trying to change this global health landscape. And how can we think about new problems? And this isn't just global health, right? This is, if you want to talk about climate change, we can talk about removing carbon from the atmosphere all day long, right? But if we don't talk about the fact that the vast majority of climate change and greenhouse gas emissions come from the top 100 corporations, then we're missing a substantial portion of the problem. And so this isn't just about health. This is how can we, as a younger generation, think more creatively about some of these huge issues. So now I'm going to jump back to what I'm doing now in my educational path. And so all these examples that I just talked about here, I realized during my undergraduate studies at Cornell, which was 2016 to 2020. I just graduated in May. And so I came in as a biology major, I wasn't thinking about these things. And then being able to explore and spend these 4 years changing my major several times. For me, as many people, it was a period of evolution. And for the people who are early in their undergraduate careers or just about to start their undergrad or still in high school, I absolutely encourage you to take this undergrad time to explore. And for me, part of this was the realization that although I was fortunately accepted into medical school in New York City, I decided not to attend because for me, don't get me wrong, there's such an important role for doctors to play in this. Doctors are some of the frontline activists driving the changes and new perspectives that I'm mentioning right here in this presentation. But for me, I wanted to pursue more anthropology research, more social science research. So now I'm doing my PhD in anthropology at Oxford in the United Kingdom. My research is focused on the humanitarian crisis in Venezuela right now. So here is a photo of Caracas, the capital of Venezuela. And just for context, Venezuela is this country right here. This one in red, right on the tip of South America in the Caribbean. Venezuela has had a huge humanitarian crisis over the past decade because of economic mismanagement, corruption, a political crisis. They have two presidents right now that are battling, a dictatorship, authoritarian regime, all of these different factors that have created this incredible and really tragic humanitarian crisis in Venezuela. And so what I'm studying is how people in Venezuela right now access pharmaceutical drugs, despite the severe shortages that this crisis has brought about. I'm also studying what the role of NGOs and humanitarian organizations are playing in this, and also what local activists and pro-democracy movements, what role do they play in shaping health of Venezuelans in the future of Venezuela. And so that's where I am. That's how I made my path here. But I don't want this to be about me and what I'm doing. I want this to be about how can we together think about new perspectives on these century-old issues like health. Um, and so moving forward, I again just want to submit this idea of we need new ways of thinking, and that youth need to be at the front line of this. We need to be at the helm of this, the ones building, creating, and rethinking approaches. Because once you join these institutions, when I was at the World Health Organization, they think about these issues in ways, again, that I find very problematic. How are we going to talk about the situation in Yemen without talking about the Saudi Arabia-led intervention that's driving the outbreak? And those aren't conversations that are happening within the walls of these institutions. Those conversations aren't happening in governments. They're not happening in these NGOs to the extent that you think. And so we have to carve out that space in a very real way. And people are going to say, oh, we don't do that, like I heard, or people are going to push back. So it's really not going to be easy. And it is very much so a fight, and we do have to get involved in politics. I know there's really political turmoil in the United States right now. And I think a lot of people, friends and family, have been affected by the things that are happening in our country right now. And whether or not you want to get involved in politics, in many ways, there's almost a responsibility to do that. And we have to be able to support these most marginalized people who don't have the seat at the table that we will be able to have through our education, right? I mean, the fact that we're sitting here on a computer able to have a Zoom conversation is a privilege, right? Some people don't have computers. Some people have to work to be able to support their families, no matter how old you are. Some people don't have Wi-Fi. And so us being able to have this conversation right now, me being able to have these experiences that I can even be able to share is privilege, raw privilege in of itself. And so I think it's really important for us to acknowledge that, but it also gives us a responsibility for thinking about how can we introduce new perspectives? How can we have these conversations? And how are we going to shape the future of health or whatever industry that you're interested in? So I'll go ahead and stop there. I want this to be like an entirely open, informal conversation. Like, please don't, like, if you have questions, shoot questions. But if you want to share your experience, your thoughts, your frustrations, like, please absolutely do so. And I know there was a lot of things that there were some questions about that I didn't mention. For example, my work at the Florida Department of Health, or about epidemiology and COVID and so on. So I'm glad to talk about those things as well. But I just want to open it to not even just question and answer, but just conversation. But question and answer if you're interested in that, if that's your thing. So I'll stop there.
Person had asked that how can you think in a different way? Like in the Mexico case, you had to think about like the obesity of the sugar and things like that. So how do you say the youth can think in a different way like that?
Yeah, so I think the first thing is being being trained to recognize that these factors play a role in the first place. Because up until when I was 20 years old, I never even was even thinking about these things because my education made me think more about what was happening inside a cell than what was happening across a border and for economic benefit, right? And so I had to be trained to think about these in a certain way in the first place, to be able to even think, oh, how are these policies shaping the lives of people, or how are certain histories shaping the lives of people? So I think the first part, and this doesn't mean you need to be a sociologist, you need to be an anthropologist, you need to be a political scientist, right? Scientists do this work, and physicians do this work, and so on. But taking that time to try to think outside your own box and your own bubble, reading articles, and again, like beyond this conversation, if people are interested in any of the things I'm talking about, I can send you readings, I can do this. But you know what I mean? I think it goes back to my freshman year when I asked people, what classes should I take? And they were always saying anatomy and physiology, take more biology, take more this, it'll make medical school easier. And don't get me wrong, some people love that stuff, and I encourage them to do that if they do. People learn about these things in different ways. But for me, that was not how I wanted to do it. And so it's not a perfect answer. And I think we're all going to have to try to think creatively about how we do this. But I think just recognizing that in the first place is a very, very important first step. Like we need to have the right frameworks for even thinking about the problems. So.
Thank you. And another question had asked that, take me through a day as a epidemiologist or, yeah.
Okay, so in terms of my work as an epidemiologist, I was from between April and September, August, I was working at the Florida Department of Health on COVID and tracking cases in Florida in my county. And basically it's very number driven. We get a positive test result, and then when that information comes in, we put it into these data systems. We have addresses attached to them. Sometimes we have race and ethnicity data. Sometimes we have gender. But basically, you take all of that data and try to use it to tell a story. And so for me, a lot of that was sifting through these data sets and trying to figure out what was happening, right? So something I was talking about recently is we can look at Florida, for example, and say Florida has this many COVID cases. But what does that actually tell us, right? We can see that cases are going up, but where are they going up and who are they going up for? And I think that's a really important question to consider because, for example, in Madrid right now in Spain, they're having a second huge wave of COVID. But where is that happening in Madrid? It's happening almost exclusively among the poor people because they can't socially distance in their homes, because they have to go to work, they're service workers, because of all of these different factors. And so for me, my part as an epidemiologist was trying to break that down and try to add some texture and some details to what was even happening. And sometimes that was impossible. You know what I mean? Because we talk about the importance of race in all of this conversation, right? Because of how racism has predisposed certain people in certain bodies to fall more ill when hit with COVID. And so for me, I wanted to be able to track those and see who is being affected, why are they being affected, at what rates in my community. And the data just wasn't there. And so that gets into some of my frustrations with the role of epidemiology in this conversation. But I'll go ahead and stop there. And if people want to ask follow-up questions about epidemiology, I'm glad to talk about it. But
Hi, I have a question. So I just wanted to ask, what do you think about like how global and public health organizations should play a more like active role in politics to emphasize like the negative impact of like, governmental policies and whatnot? Like how can they do better at like, playing an active role in that?
yeah, so that is a really, really hard question. Because so going back to like the WHO example in Yemen and Saudi Arabia, Saudi Arabia is a member state of the United Nations, which means that they finance the United Nations, and the WHO is part of the United Nations. And so if the WHO started openly and publicly just like roasting Saudi Arabia, right? Just to like be straight up and informal. Like if they just like started doing that, then how would Saudi Arabia respond? Like the WHO is in a very weird position of that it is constituted by countries. It's not independent from any country. And so we saw that with the United States pulling out from the World Health Organization just several months ago because of saying it was China centric. And so that is something that I have been trying to think a lot about recently of are the question of are our institutions even capable of doing this? And do we try to change these institutions or do we have to try to build new ones or change how we like fundamentally how we even think about global health? Should global health happen at a more activist level? And so what I'm looking at in my research in Venezuela, for example, is the government has largely blocked international organizations. The Venezuelan government has blocked these international organizations from working in Venezuela for a number of political reasons that I don't need to go into. But what you've seen is that Venezuelans who would never expect themselves to be humanitarian workers are now finding themselves doing exactly that. They're creating these small NGOs, you call micro NGOs of 1 to 3 people working in the back room of their home, trying to create new ways of thinking and try to forge a way forward for their communities. And I'm looking specifically at how they access pharmaceuticals. But what you see also is that those people are oftentimes part of the pro-democracy movement in Venezuela. They're often very involved in trying to, they're activists. And you don't see that as much in public health because there's such a stark divide between politics and global health, or politics and development. That's like, they're separate things. We don't talk about them together. And so I don't have an answer for that. And I don't think anyone, unfortunately, has an answer for that, but I think it's something that we need to be thinking about. And what I'm hoping for, at least in my circumstances, by looking at the Venezuelan context, what can we learn from Venezuelans? How can we think more creatively? What is an alternative future for humanitarianism? And for me, in thinking about what these alternatives can look like, that's why I'm studying Venezuela, because there are no international organizations working there. It's all these local grassroots sorts of humanitarianism, you can call it, and who don't subscribe to these institutional frameworks, or people who don't have the education that we are fortunate to have necessarily. And so it's a work in progress, and I would encourage all of us to have that conversation and keep it going. But yeah, it's a challenge.
Thanks.
I think Emily has a question.
Hey, Dalton.
Hey, Emily.
First of all, thanks for taking time out to give this talk. And I really appreciate it because a lot is relevant, and this is a conversation that I think more people need to have. My question for you, so I'm in a gap year before medical school, fingers crossed, hopefully I get in. I was wondering, because FAU asked a question on, you know, what will you as a future medical student do to combat institutionalized racism? And I felt like that was such a hard question, but I thought deeper into that, and it's like, have you ever been in a position where you want to put in the works enacting some sort of change within an institution, but to balance like knowing that you're inside that role? And I know a lot of people are afraid to kind of speak out or go against the change because of interests that changing the system that you're, if that makes sense. Like, how would you go about get like advocate, for example, like graduate students at UF, like advocating to have better pay, if that makes sense? Like, how would you go about?
Yeah, so you cut out intermittently, but hopefully I'm hearing you correctly. Basically, you talked about the example of Florida Atlantic University. No, you're good. You're good. But basically, the example that FEU is saying, how are you going to try to address institutionalized racism? And your question is how we even think about that in the first place, or sorry, if you could just clarify. Yeah. So again, I have not to reiterate what I just said, but I think we can go beyond it a bit. So the first step, of course, is recognizing that there is a gap in the existing knowledge and the existing frameworks for thinking about these things. So when I showed the Global Health Security Index and then transitioned to the distribution of COVID cases in the world right now, like that, I mean, just being able to be critical in the first place, then preps us to try to even think about solutions. Because to think about solutions, you need to understand the problem in the first place. And I would argue that we oftentimes don't understand the problem. And that's why I focused on this particular topic today as compared to some of the specifics. But in terms of how we apply pressure to start change, I think there's, I think, okay, so I think this is a personal, I guess a lot of these answers are kind of biased to like what I think, but for me, I think there's so much to learn from social movements, from things like Black Lives Matter, right? That the amount of money that's going towards research right now in terms of health disparities for Black, Indigenous, people of color communities because of the Black Lives Matter movement is insane, right? And it's not just Black Lives Matter. Think about, there's Rhodes Must Fall in South Africa, of pushing against histories of colonialism that have shaped their country. Or think about the feminist movement, which really, though the United States likes to claim that we're leading the way on feminism and shaping that dialogue, most of it came from Latin and South America, strong feminist women actors who were shaping the conversations. And now you have so much diversity in that as well, of trans actors joining that conversation and being at the helm and shaping those and being in public spaces and speaking about those things. And so for me, that's something that I'm trying to reconcile in my own work of, yes, I want to work in these institutions, but then at the same time, there's these movements that are beyond any singular institution that have such a profound impact. Or just even thinking about, I guess something that I've been thinking a lot about recently is the power of shaping public dialogue and public discourse. By that, I just mean really like what we talk about on the news, what conversations we have in public. And I'll give you an example. So in 2016, for the Democratic elections in the United States, let's talk about single payer healthcare or universal healthcare, making sure that every single American has health insurance. No one will be able to not afford healthcare, that everyone has quality access. When Bernie Sanders came in and started advocating for a single payer healthcare system in the United States, people thought in 2016, people thought he was crazy, right? People were like, you're a communist, you're a socialist, this, that, here, there. But now, 4 years later in 2020, if we rewind to the Democratic debates, almost the majority of the people on that stage supported a single payer healthcare system. And we cannot ignore the fact that Bernie shaped, and whether or not you agree with single payer healthcare system, the way that Bernie and activists throughout the country injected that into the public conversation, and then how that changed the conversations about the future of healthcare radically in just 4 years, I think that's so important. Or even with going back to Black Lives Matter of, I mean, again, whether or not you agree, the conversation about defunding police, like this was a conversation no one was even having. It was something that I wasn't even thinking about, the idea of not the idea of taking funds from police officers and putting it towards mental health and drug abuse programs and rehabilitation programs and homelessness initiatives. So these aren't even things that are an issue in the first place, things that don't have to be addressed by police officers. And so I think that is something that I'm also thinking about, of how do we inject ideas into public discourse? And yes, I think activism plays an immense role. I think social media can be very, very important. I think politics is important as well. I'm not saying that all of you need to be like an AOC or someone, you know what I mean, like trying to shape conversation in these very, very public spaces. But again, like there isn't a single solution, but I think we have a lot to learn from these activist groups that are the ones, again, putting pressure. And there's even like data that suggests that when these activist organizations become formal institutions and organizations, they lose that fervor, they lose that momentum that they had as this kind of, you know what I mean, as this like very spread out social movement. So I mean, there's a lot to be said there, but I'll stop on that. But if you have any ideas, I'd be glad to hear those as well, because this is something that I'm trying to learn as well. I think the questions that people are asking right now are the same ones that I don't have answers to, but I think about almost every day.
What advice do you have for people that are aspiring to go into the career of global health?
Yeah, so I think, again, just going back to that first point of just frameworks, like how can we think about this? And something, catch you later, Emily. Thank you for your question. Just hopping off. But something that I was thinking about is at my university at Cornell for my undergrad, there is a global health major that says, I mean, people can specialize in different areas and take different classes, but there's a standard curriculum for global health. It's called GPHS, Global Public Health Sciences, I think. And for the longest time, I've thought that's a great idea, right? Like having a set curriculum to have conversations about something like global health. But just yesterday, I was having a conversation and saying, I wonder if that isn't the best idea. What if we didn't have a set curriculum for global health and had people in all different areas, different majors, studying their respective disciplines, but then a kind of umbrella or interdisciplinary conversation about global health. And I'm not saying that there shouldn't be a global health major, but again, going back to that idea of saying this is how we should think about global health and what this is, right? That single narrative or perspective of how we should be looking at an issue. I don't know, I take issue with that in some respects. And this is like a 24-hour ago development. So this is like a new line of thought that's been on the mind. But again, like reading things that you wouldn't otherwise read beyond your discipline and taking, you know what I mean? I think we have a conversation about medical school. And whenever I was talking to people who want to attend medical school, there's always this checklist of, to go to medical school, I need to do life science research. I need to volunteer in a hospital. I need to do this standard checklist of things. But for me, when I was hoping to attend medical school, the summer after my sophomore year, I worked at Aetna, CVS Health, like a huge corporate health insurance company, because I wanted to know what role does private sector play in this national health conversation. Or my freshman summer, I did more like a small nonprofit and things like that. So I think if anyone tells you you need to do X, Y, and Z to do a career in something, whatever that something is, I would take that with a grain of salt, step back and say, okay, maybe I can integrate X, but maybe I can also add A, or maybe I can add B. Sorry, maybe these letters aren't making sense, but I mean, trying to mix and diversify and not go against the grain, but I think that's the best thing we can do, because even the perspectives that I'm offering here right now on politics, like those aren't the only ones. Those are the ones that I've found purchase in, the ones that I've really been compelled by. And so maybe people will find something else in economics, a new way of thinking about health. Or maybe people are already having those conversations, but they aren't granted access into these big global health institutions that are run by physicians, epidemiologists, public health scientists, and so on. So that's what I would say.
Thank you. And another question that I have is that, like, you said that there are organizations that don't care, like, like going back to the Mexico case, it's like they don't care about the obesity and how we could stop it. Why do you think that the organizations are like that and saying that it's not part of their job to do that?
Yeah, so that's a challenge. I mean, part of it is because, we're trained to think that health is the responsibility of a doctor. Like that's right. Correct me if I'm wrong, but that's how we're trained to think about these things. When we think about health, if I go ask my mom, who doesn't have an education, I say, "Mom, who should be in the conversation about health?" She's probably going to say, "Doctors and scientists," because that's how we are trained to think about it, at least in the Western context, in the United States. Outside of the United States and oftentimes Western Europe, there are a lot more interdisciplinary perspectives about how we understand health. You've seen great perspectives in India, China. Sometimes we would call these like alternative medicines, and I'm not saying that that is what I'm pointing to, but there's other ways of thinking about health through community and social support networks and things like that that help with things like mental health. But going back to your question, I think the first is just these very like normative ways of thinking about these people are the ones who do that. You know what I mean? And I think that is the first issue. But then the second point I want to raise is, when we think about humanitarian organizations and how they're going to change and how they consider these things, I don't know. It's hard, right? Because it's so deeply ingrained in these institutions, like the WHO Constitution, or not even WHO Constitution. When I was working at the Florida Department of Health, I was looking at the Florida Surgeon General, the person who heads the Florida Department of Health. And to be in that role, you have to be a physician. And if you listen to any people in public health, they're like over physicians running public health. You don't get me wrong, you have like physicians who work in public health and learn, you know what I mean? But like Dr. Fauci, for example, he doesn't have experience in public health. And so he has experience in science, but he doesn't have experience in public health. And so there's actually been a lot of people in public health who have been frustrated by Fauci in some respects, because he looks at these very like cellular and molecular biology mechanisms for disease and how disease and pathogenesis and all of that. And a lot of people who work in public health and are organizing and looking at non-medical factors that bear on health are kind of frustrated by that. And I think a great example, again, is to be at the head of the Florida Department of Health, you have to be a physician. And I think it's, in some respects, it's kind of messed up to say that. I think it's kind of disparaging to some of the community health workers, people who might have just their master's in public health, or people who are just case management, people who don't have an education, people who are advocating for change. And so I know I'm not necessarily answering your question there, but yeah, it's a challenge.
Is it okay if I kind of like add something into the conversation or whatever?
Help me out here.
Hey, no, I was just gonna say, I remember, just to like kind of go along the lines of that and bring up a personal experience that I had. I was shadowing a physician in the emergency department one day, and I remember just, one of the other physicians, seeing a patient, coming out and saying something along the lines of, uh, being frustrated and saying, I'm the one who has to deal with the poor health choices of this individual, like the negative, the negative impacts of their poor health choices. And like that really rubbed me the wrong way. And I was just like, what if it's not entirely their fault? Like it can't entirely be their fault for them being in this situation. And it just kind of like, you know, going along the lines of like, people being in these positions of power and like, needing to have knowledge of, just public health and the different things that, go into it, and just like kind of bringing into the conversation, like how can we even help train physicians to have a better and more like collaborative mindset of like, considering other factors of, even just like individual situations and like public health and politics and how all of that plays into it, I think is just like really important. So well.
And physicians are so important. Like there have been incredible, like, and again, like I sound very biased here against physicians and against like people doing science, like it's STEM. Like they have really shaped the conversation about health in our country and internationally as well. And so while not everyone who works in these spaces is perfect, like she just referenced, like there are really incredible people who are paving the way. And so hopefully I'm not discouraging anyone from doing medicine or from being a scientist or things like that. But instead recognizing that these are all kind of interconnected things that we need to be thinking about in new ways. So. And if anyone else has like other experiences, like please like throw it in, or like an experience you had with a healthcare professional or something related to politics or just really anything we've talked about. Like I don't need to answer questions. I'm not qualified to answer questions anyway, probably about these things. I'm more here to learn from you all as well. So, but no pressure.
I think we can start wrapping up. So it would be great if everybody could put their cameras on. We could take a photo. Thank you. And the feedback form and all the links to Sparked are going to be in the chat in a second.
Cool. And to the point that was mentioned here, yes, I can send readings. If one of you, if you want to reach out, send me a follow-up email, I can send you readings that you can send to people if that would work for you.
Yeah, could do it. Great.
Okay, great.
Okay, so then I guess if you do the feedback form, or if you just contact us to let us know that you would like us to send that to you, then we can do that.
Cool.
But other than that, you guys are free to go. I hope you enjoyed the talk, and I hope that we can see you at future Spark Ed events. And yeah.
And thank you all for attending. Thank you for letting me rant about these things. And hopefully you'll be the one teaching me these things in just a couple of years. So
Thank you for attending. We definitely learned a lot.
catch y'all later.
Thank you.
Bye. Thank you guys.
Thank you.
Thank you.